Hi, I'm Corbett from the Department of Medicine, and I'm here to talk about the skills that we'd like the students to acquire in the first year in the use of the ophthalmoscope, and more specifically, examining the undilated eye. What we've designed is a five-step skill exercise that we'd like you to take them through one step at a time, and I'm going to illustrate those. The first two will be strictly me showing you some things about the scope, and the other, with Bill's kind help, we're going to demonstrate the last three steps, which have to do with positioning and the actual examination of the eye using the lens skills that I'm going to show in just a second. So it's a five-step process, and it really involves knowing how to use this scope. So what I want to start with is just talking about the scope for just a moment. Most scopes, of course, turn on at midsection with a switch that actually adjusts the intensity of the light itself. And if you'll notice as I turn that, and most students don't always appreciate that, so we want to be sure that they notice that, because when we do the examination of the exterior part of the eye, we want bright light, and when we want them to begin to learn how to observe the disc in the retina, we want them to be able to turn the light intensity down. So they need to, as simple as that, they need to learn to use that switch. So the first two exercises have to do with simply introducing the students to the two types of lenses that are on this scope. And the way we would like the students to learn about this is to actually have them demonstrate it to themselves first. So what they'll do, what you'll have them do is you'll tell them to hold their hand with their glasses off. The refractive power of these scopes are much greater than the refractive power of most human eyes, so they don't need their glasses. Turn the scope on and have the student hold their hand 3 inches, just about 3 inches from the distance of the scope. And to turn the lens circular until they see some structure on the back of their hand in perfect image, with perfect sharpness. And once they've done that, we want them to take a look and see what lens they're using. Invariably, they're going to come up with a green or black numbered lens. These are your short focal length lenses. And once you've gone through your group of students, you'll find that depending on whether they're far or near, that number may change. But the basic idea that we want them to get at this level is simply that if you are about 3 inches, you're going to have a number on here about 3 to 5 to 7. And once they've done that, then the second part of that exercise is to ask them then to do the exact same exercise, but pull the hand almost completely into the nose and to redial and to once again look and see what lens they're using. I happen to go from a green 3 to a green 9, and so it just simply illustrates that as you dial up using the green or black short focal length lenses, that the focal length diminishes. So we want them to begin to get used to the idea that these short focal length lenses, the number that comes up on the lens or the lens that you use is really just a function of how far they are from the object they're looking at, usually within about a 5-inch distance. So that's the first exercise. Once they've done that, then you want to do an exercise that introduces them to what are called the infinite focal length lenses. These are the ones that are noted by having a red number on the scope. And the exercise that illustrates this to them, and it's better almost to do the exercise first and talk later, is to have them look at something across the room. Maybe it's going to be an outlet, maybe it'll be the corner of a picture, maybe it'll be the hand of a watch, and have them turn the dial again until they get a really sharp picture of something. Now, right now, I'm on a red 3. Invariably, students will give you a red 0, 1, 2, 3. Your myopic or short-sighted or short-sighted students, nearsighted students, may have to be dialed up to an 11 or 12 and occasionally higher. But if you have them go through that exercise, they will identify the long focal length, what are called the infinite focal length lens that fits their refractive power. And so it's probably helpful to point out to them with the short focal length lenses, the number they dial is a function of their distance from the object, whereas the long focal length lens that they get for looking at something across the room is going to be a function of their refractive power. And if they're a 3 now, they're going to be a 3 10 years from now. I've been a 4 since medical school. So that's the short focal length exercise and the far or infinite focal length exercise. And then they'll learn, for example, from that if you want to look at a retina, you just dial up to your unique long focal length number, mine's a -4, and that'll serve you to see most people's retinas as soon as you go in without having to turn and turn and turn until you find the right one. So they're actually the first two steps. Now what I want to do now is to talk a little bit about positioning, which is the third exercise, and then I'm going to show you how to apply the two lens looking skills to actual examination on our friend Bill. Now the positioning exercise has to do with the ideal position that the student needs to be in to have good visualization of the eye. The ideal position works something like this, and let's see, Bill, maybe if I can get you to turn this way so that we can get a side angle. The idea here is that the patient needs to be comfortable, and so does the examiner. But they also have to be aware that one peephole is trying to look inside of another peephole, so that you have to be fairly close. So the student has to begin to get comfortable with being that close, but also, and probably more importantly, is making the patient feel comfortable with a close examination of the eye. And so this exercise has to do with simply having the students know that there's at least 2 or 3 things to be sure and do. The first is have the patient be comfortable and give them something to look at that's straight ahead and level. They need a specific thing to look at, otherwise the eye tends to wander. So Bill, let's see what's straight ahead, and maybe the lower left corner of the picture. So if you'll just watch that as we do the exam. And so number one, and it's a simple thing, but it's important not to go past it, is give the patient something specific to look at. It should be level and it should be centered so that when the examiner comes in to examine the eye, they know exactly where that eyeball is facing. And that becomes important with more detailed examination of the retina. For positioning, for holding the instrument, you generally should hold the instrument in the same hand that the eye is looking. So I'm going to first look in Bill's left eye, and I'm going to hold this in my left hand. The second important piece is to have your hand on the examiner's head with your thumb above their eyebrow. This allows you to know exactly where the patient is, to give some steadiness to the exam, but also enables you to concentrate on looking through the scope and let your proprioception tell you exactly where the patient is. So this is the correct position that we like to have the students assume. Holding them like this is fine, but for some patients especially, there may be too much movement. Not touching the patient at all makes it very hazardous because it's very easy then to have the examiner bump into the patient. So hand above the eye, hold things steady. Left hand for a left eye look, and right hand for a right eye look. So that's basically what we want them to be able to do in terms of the positioning. Now, I'm going to now apply what I would do if I were actually going to examine first Bill's eyes with a short focal length lens, and then I'm going to do the same thing with an infinite focal length lens, and that'll be pretty much what we want the students to be able to do. So if we wanted them to examine, say, the cornea, which is an extraocular, or at least it's anterior to the lens, you would have them dial up to a 15 or a 20 on the scope, which pretty much places the distance of the scope from their eye about 1.5 inches. So I've got this on a 20, and I'm going to just demonstrate to you how close I need to be to have Bill's iris in perfect focus. That means the plane of the focal length is coincident with the plane of his iris, which is about where you want to be if you want to do an anterior chamber or a corneal examination. My right hand is on the head, thumb above the eyebrow. Keep your fingers out of the eye so the patient's not uncomfortable. I have the scope in my left hand for a left eye exam, and I'm going to try to come up so I'm at least less than 2 inches from the cornea. And now I've got an excellent view of the iris and can see all that I want. And the value of having your hand up here is that if you come close, you hit your own forehead on your thumb before you hit the patient. So this technique is very important. Then we would do the same examination on the other eye. Excellent view of the iris. And I'm probably just about 2 inches, maybe a little bit less from the cornea. Is that comfortable, Bill? Did you feel like that's fine?
Yes.
So we want them to be able to do that, and the iris is probably the best place to focus because it's got color and sharpness and detail that allows a student to not be too far off if they have to move in and out or get themselves positioned for a nice visualization. And finally, the last exercise we want them to do is we want them now to go back and use the infinite focal length lens, the red numbered lenses, have them go to their unique number. In my case, it's a 4. Now for this exam, remember it's important to have them turn the light intensity down. Most of these modern scopes have lots of fiber optic intensity, and there's too much reflection if you leave the light all the way on. It's better to turn it down about halfway of its intensity. unique number on, same exact positioning, only this time, if the patient indeed is staring at something straight ahead and horizontal, and if the examiner comes in relatively anterior, looking through the pupil, they will land right on the retina, and that's exactly what I was able to see. So it's the exact same positioning here, patient looking ahead. And notice this time, since I'm not in your way, that when I have his retina in good focus, watch how close I am to have a good size of visual field. So right now, I can see Bill's disc, and it's almost completely in my visual field. And I would bet, Bill, what would you say, was I a couple of inches from your eye?
At least, well, I thought you might have been closer than that.
Maybe a little bit closer. So, and they generally have to be within 2 inches to actually have enough of a view of the disc to recognize it, to see it, or at least to see most of it in one visual field. So that's the long focal length exercise. Okay, to sum up then, remember, we want to be sure the students go through 5 steps in their beginning use of the ophthalmoscope. The first is to be sure and appreciate the short focal length lenses that are usually denoted by the black or the green color numbers on the lens meter. The second is their identification of the infinite focal length lens that fits their refractive power. These are usually denoted by a red number, and that number will stick with them for many years. Step 3 is to introduce them to ideal positioning, which includes the patient's gaze, which should be straight ahead and horizontal, their own positioning, and in a way that allows them to get close, using their hands on the patient's head. And when they're looking in the right eye, they hold the instrument in the right hand, and the left eye, they use the instrument in the left hand. And then finally, the last 2 exercises have to do with using those 2 sets of lenses to observe a specific thing in the eye. For the short focal length lenses, we just simply like them to be able to observe the iris in nice, sharp detail, using a focal length of about 15 or 20 on the lens meter. And then finally, for the infinite focal length lens, have them use their unique number to simply have the eye ready, the scope ready to actually observe something in the retina. With those 5 steps, they will have a nice introduction to the beginning use of the ophthalmoscope.